America was surveyed and asked, what is the top 3 health diseases in the world today? They would probably say heart disease, diabetes, and maybe HIV. But did you know that there are 3 to 5 times more people in the world with fetal alcohol syndrome? Um, okay. How many people have seen the show on TLC called I Didn't Know I Was Pregnant? Okay. For those of you who don't know what the TV show is, it is with young adults who go through their whole pregnancy not knowing. And then one night or day, they have severe stomach pains. They go to the hospital thinking it's an issue with just their stomach, find out they're pregnant. So their number one concern is, I didn't take the proper precautions, is my baby okay? 9 times out of 10, the young mothers are partying and drinking in the previous months, so they're not knowing how much danger they're actually putting their baby in. So today I would like to inform you guys on what fetal alcohol syndrome is, how it happens, the long-term effects, and the treatment for it. Fetal alcohol syndrome, according to ncbi.gov, is a growth mental and physical problem that may occur in a baby when a mother drinks alcohol during pregnancy. Some of the symptoms are poor growth while in the womb and outside, decreased muscle tone. Oh, I guess I have to move out the way so you guys can see. Decreased muscle tone, and heart defects, and delayed developmental problems in thinking, speech, movement, and social skills. So as you can see right here, this is a baby with decreased muscle tone. It's just floppy wherever you do, whatever you do with it. And this is one of the heart defects that the baby could go through from having fetal alcohol syndrome, which is called arterial septal defect, and we'll get to that a little later. I'll explain it more in depth. And also, a physical exam of the baby will show a heart murmur, and then as it grows, you will see that it kind of isn't developing as it should. So once the baby is born, they'll do a CT or an MRI scan, and the ultrasound also will help kind of see what's going on inside. Some long-term effects of fetal alcohol syndrome are problems with the face, and they include narrow or small eyes with large folds, as you guys can see up there, and they have a small head, a small upper jaw, a thin upper lip, and they have a smooth groove up here. And then this is a picture of an actual baby with the syndrome, and this is a normal brain, and this is a brain with a baby that has FAS, fetal alcohol syndrome. Some of the heart defects that come with the fetal alcohol syndrome are called ventricular septal defects and arterial septal defects, also known as VSD and ASD. VSD is when one or more holes are in the wall that separates the right and left ventricles. So this is the left ventricle, and this is the right ventricle, and this will be the little hole that they're talking about. And then ASD is when blood flow between 2 compartments is enabled, and those 2 compartments are called the left and right arteria. So as you can see over here, this is what a normal heart will look like, and then this is what the heart with ASD looks like. And then my third point is the treatment. There is no cure for FAS, but there are some treatments that can help kind of take precautions so that none of the secondary conditions will come along and affect the baby. And women who are trying to get pregnant should just avoid drinking at all. Like, no amount of alcohol is okay. But for women who do suffer from alcoholism, there are some rehabilitation places that they should go, and they should always get checked by their healthcare provider. So in conclusion, according to www.healthnytimes.com, fetal alcohol syndrome is the biggest cause of mental retardation in North America. And I have told you how it happens, the long-term effects, the treatment for it. So always remember that no amount of alcohol is safe for a pregnant woman, and FAS is 100%